I'm going to introduce now David Balat and Dr. Marion Mass from both Free to Care and Practicing Physicians of America. David Balat is the director of Right on Healthcare, and as well as just as sort of his day job. Free to Care is the nonpartisan advocacy organization that he started, which is really his passion. And David Balat also was a former hospital CEO, and I think what often happens is if you're ethical, a lot of people want to do the right things even in hospital administration, but you either end up going with the flow or leaving sometimes. Dr. Marion Mass is a pediatrician and should be a bit of a household name here. Is really just not wearing a bathrobe today, but that's her signature look. And is very good.
I was actually disappointed that she wasn't.
All of the middlemen in healthcare. So they're going to talk basically a conversation on raising a coalition against the corporate practice of medicine. And I really do like how we have quite a nonpartisan showing today. There's a real recognition that the healthcare system is broken regardless. And I think ultimately we want the same thing. So take it away, guys.
Great. Thank you so much. Marion, good morning.
Good morning, David. How are you? How's Austin?
All is well. All is well. I wanted to start off by saying thank you to Mitch for having us on, for this group, for all the work that everybody is doing. Whether you're actively involved or you're just now beginning to express an interest, it's important that we're involved. And like he said, regardless of where you are on the political spectrum, healthcare is about people. It's about the patient. It's about that doctor-patient relationship, and it's not about politics. It's extremely personal and not partisan. And that's what we espouse and are committed to in Free to Care and everything else that we're trying to do. If we don't care for and defend the patients, then nobody else will. Marion, I'll let you go in, and then maybe we can start the discussion.
Sure. Can I do a screen share? Let's see.
Sure.
I want to pull up. Go back to this. It's just something I like pointing out to people. I pointed it out to a friend of mine the other day, and he's like, "Nah, I can't unsee that." There was this was a poll that's done every year. I can't remember if it's Rasmussen or who does it, but they ask Americans what professions that they rate in terms of their ethics. And this was done at the end of December 2020, and it's compared to December 2019. And if you look at this poll, and I say bedside nurses, because I think that's what most America thinks of when they think of their nurses, and medical doctors and pharmacists, out of the top 4 ethically viewed professions, the medical profession has 3 of the 4. And if you look, actually, those groups bumped in numbers, and medical doctors bumped by 12 points during the course of 2020, during the course of the pandemic. Now, if you look at, who's down near the bottom and dropping, here's members of Congress. Like, they lost 4 points. And, take a look at everyone else that's down here. Business executives, the people that we're talking about, they also lost 3 points. But who do the business executives work with to keep their power and the control over medicine? Well, they're paying off the advertising field, who's also down and losing points. They're working with a lot of the legal profession. They're probably working with journalists who are just breaking even here. They're probably working with the bankers. I can't believe they're up by 1, and they're all, whether they're on the right side of the aisle or on the left side of the aisle, paying into the pockets to keep these people who are viewed very unfavorably by Americans on the right and the left side of the aisle, and to keep all the rules in their favor. And, people say all the time, are we going to be able to take medicine back? I always think to myself, we just need like a little push, and we need more involvement, and we need to start gathering groups together, groups of bedside nurses, because they're frustrated too. And, they are there on the front lines taking care of our patients with us. We need to pull together the independent pharmacists who are out there in our community. Because if you look at big medicine, one of the things that big medicine has taken back is, or one of the things that big corporations have taken over is, the pharmacist's role as well. Look at CVS, look at Walgreens, look at Rite Aid. Everything has been turned into a big box operation, and the business executives are running it. But if you look at what the Americans what Americans really trust, I think what they're trusting in it, when we can see the top part of this poll, is they're trusting expertise. And we have expertise. And I think it's time that we gathered together with other people of expertise who see what we see and are tired of seeing our patients get beat up, and then get together with the patients in a coalition. And that's how we take medicine back. I'm done screen sharing, so.
I think you'll need to unshare. The group is about how to create a coalition army. And, we just recently had our conference as well. And Free to Care is a member organization group with 32 members, over 8 million people represented, including over 70,000 doctors. The very first panel that we had, and Mitch was a speaker on one of our panels, was about unity. And that's extremely important. It is that linchpin issue, because in order to have that army, you've got to have a common vision. What is it that we're fighting for? What is it that we're aligned together on in doing? And what we've seen a lot of is the hospitals, the insurers, the various agencies of the government are trying to divide physicians, and they're trying to divide doctors from pharmacists and doctors from nurses. And what they're just scared to death of is when we get together and we go and defend the patient, that we will be able to have some momentum. We will be able to make that change. And that's how we do it. The very first step is, regardless of our differences, what is it that we agree on? What is it that we can stand shoulder to shoulder and fight together as brothers and sisters? That will allow us to make the moves and to move forward. And that's the essence of how it is that we begin. Now it gets very technical, and as developing strategies and tactics as to how to implement the things that we want to implement. And we can talk more about that here shortly. But the very first step, and Marion, I'd love to get your take on this, is having that strength and unity.
Oh, absolutely. Finding our commonalities. I mean, the one of the big issues that I've pushed the most on is the pharmaceutical and the hospital middlemen over the past 3 years. I'm sure you've seen me, like my kids know what a PBM is, which is really kind of sad, I guess, or happy, I'm not sure which. But it's an issue that once you see, you can't unsee. And once you see that these large corporations are offering, if we made a ratio of the amount of money extracted versus the value of the organization or its components, these guys would win hand down, because they're not really offering anything of value to the patient. They're just siphoning money out of the pockets. And then they're taking that money and spilling it back in order that they keep their control and they keep their rules running their way. And they're strategic enough to put the money in across the aisle. If you start snooping around in something called open secrets, you can see that, large insurance companies, the American Hospital Association, Big Pharma, the PBMs, the insurance companies that they're tied to now, healthcare IT, and even the AMA, they dump money into Congress across the aisle very strategically. And we foolishly, as physicians, I think usually align ourselves with one side or the other. We pick a red warlord or a blue warlord, and then we get angry at the other side. But these big corporates are smart enough to realize that they're winning by dumping into both sides. And we've got to get strategic as physicians and to be able to come up with ideas that cross the aisles. And quite frankly, there's so many things that cross the aisles. And if you just take the corporate medicine issue as a whole, just pushing back on uncovering the money is one of the most simplistic things we can do. Who's making the money? Because Americans are losing it. Their wages are flat and they're ready for a change. And so it's time to open up the books and to expose these people who are offering really very little value to the American patient and to show them who does offer the value to them. That's
Yeah, we talk a lot about transparency. It's one of the major issues, and we've talked about it with Mitch and Dr. McNamara about I mean, in emergency medicine, having to deal with PE groups, looking at being able to look at how these guys are billing under the names of the physicians. That should absolutely be transparent. There's no reason that the work that you do, you should be able to see what that translates into in terms of the billing. But that's just one piece of this much bigger word that we're trying to advocate for in transparency. The more that they hide all of this information, the more powerful they are. So we want everything to be above board, on the table, nothing below the table. Everything's on the table. Everything is there for the doctor and the patient. Ultimately, healthcare is about the doctor-patient relationship. And the reason it's gotten so inefficient, so expensive, so crazy is because all of these middlemen that have come in between those two stakeholders that matter the most. So yes, no, that's if you want to see what it is that we attack, it's usually those barriers that have relegated the increasing distance between doctor and patient, and we see that figuratively and literally in the exam rooms.
Yeah, it's also nice to see that transparency has taken a role for both sides of the aisle. I mean, you know, the Trump administration put forth the transparency at executive order, and the Biden administration's doubling down on it. And, you know, one of the things I found like really wonderful to see when the Biden administration doubled down on the hospital price transparency rule, they did it in a way where they gave credit to the administration before them. And it was really smart and strategic, I think, of them to do so. You know, they pointed out that we're coming down like twice as hard. You know, we agree with the former president that opening up the books on the hospitals and, you know, what their costs are is a good thing to do, but they didn't go far enough. We're going to go farther. I mean, 2 presidential administrations pushing on transparency, that's huge. And it really, you know, it behooves all of us here to get with our members of Congress and point that out. And don't make it like a partisan war. You know, point out both sides of the aisle here at the administration level, we're pushing on this. What are you going to do about this at the legislation level? What are you going to do to codify this? And you know, I don't, you know, if you're an R and your lawmaker's a D, or you're a D and your lawmaker's an R, who cares? Go talk to them anyway.
And Marion, if I may, how would I say this? Maybe this is the cynic or the fact that I'm jaded is why I'm saying this. You know why they both like it? Because 9 out of 10 Americans say they want to see the prices. It's not because of their altruism. It's because they know that's what the majority of American people want. And they're looking at the polling, which is what a lot of politicians do. So the more that we educate the folks at the grassroots level, the more that we have our message and we tell people what it is that will make healthcare better, more affordable, more accessible, fixing the safety net, making your doctor more free to practice independently and according to the training that you've received. That will prove out in the information that is getting back to these politicians, and it'll cause them to move. Because yes, we don't have a lot of money. We don't have the money that the hospital associations have. We don't have the money that the insurers have. But what do they use that money for? They use that money to solicit and increase the number of votes in the next campaign or the next election. Well, let's go to the voters. Those are your patients. Those are your neighbors. Talk to the folks and let them know. Help them understand what it is that you understand, because it's important that they get a better sense for this crazy complex industry. But we can do it in such a way where we just make it more plain.
Another helpful thing is to point out to the public and tell the public to point out to the lawmakers who are the anti-transparency villains, who are trying to obstruct. And, you know, it's the hospitals and the insurers came out with big guns and, you know, pushed back on these executive orders. In addition, like, who's getting special exceptions to it? The Medicare Advantage plans And I'd like to think that the Biden administration is not doing this out of nefariousness. They're doing it because like the wrong voices have been whispering into administration and congressional ears for decades. It's nothing new. They have enough money that they're down there and they keep on telling the same, what I call convenient untruths. So the Medicare Advantage plans got a special exception from transparency in April of 2021 from the Biden administration. Well, that's a real problem. Approximately 60% of hospital visits are Medicare visits, and approximately 90% of Medicare patients have like a premium plan, like a Medicare Advantage. That's a lot of exceptions to the transparency rule. It can't be tolerated. I mean, and what needs to be pointed out is that you cannot have groups, corporate groups, that are given special exceptions. We all got to play by the same rules, or there's a real problem.
Yeah.
And then, why would, the AARP, of course, is only too happy to push for this because they're functionally an insurance company. They're making a 5% killing off of every Medicare and Medicare Advantage plan and Medigap plan that's sold. So they don't want the prices of that known. And it's very, very easy for them to send their lobbyists in there. They got a lot of money. They're one of the top donors, I think, in the list of top 11. I think they're number 11 over the last 20 years of big donors to Congress.
Marion, you hit on something incredibly important. You talked about a rule that is essentially the rule of law, and now the introduction of exceptions. Now, let me give you an example of something that has happened here in Texas and a number of other states. We have a Corporate Practice of Medicine Act, which is essentially the law that says a non-physician cannot employ a physician within the state of Texas. And I can't recall how many other states. I believe it's 22. Please correct me if I'm wrong later, guys. But why is it that we have hospitals now that are the greatest employer of physicians in the state of Texas? Why is it that we have Team Health and these other PE guys that are coming in and employing not only ER groups, but GI is getting picked up, derm, and a number of other specialties? Why is it that we're seeing other types of models where corporates are managing physicians? Well, it's because there are exceptions in the rule. You can have a nonprofit, you can have a board of physicians, of whom these physicians are ranking executives or employees of that entity, that takes away from their ability to be objective. In addition to these exceptions, we're finding that the states are not even enforcing the letter of the law in these laws for these folks that are taking these exceptions. Let me give you an example. It says, yes, a hospital can employ a physician. However, they cannot, the physician must retain independent medical decision-making. Well, we know that's not happening, right? I think we can all point to an example. We all know a story. Well, my God, why is the Attorney General not focusing on this? Why is the Texas Medical Board not focusing on this and defending the physicians? Because they're not exercising independent judgment. They're not exercising independent medical decision-making. They're really being bullied into practicing according to protocols as set by their employer. That's got to change. That has absolutely got to change for the benefit of not only having more physicians, having physicians at all, but also for the betterment of the patient. Marion?
There's a couple questions coming up in here. I think Vicki Norton asked about physician-owned hospitals. There's been bills several times, Vicki, in both the House and the Senate on physician-owned hospitals. I don't know that they introduced it in this particular Congress yet, but the last Congress, Vicente Gonzalez, a Democrat from Texas, and Michael Burgess, a physician Republican from Texas, introduced the physician-owned hospital bill in the past. And, that would be a great thing if we all wanted to get together and when it's reintroduced, pushed on our lawmakers to sign on and push it over the line. I mean, can you imagine if like lawyers weren't allowed to own their own practices, accountants weren't allowed to own accounting firms? I mean, it's an absolutely ludicrous law if you think about it, but over the last 20 years, it's almost as though there's a war on practice of medicine, and there's a war on physicians owning or having ownership over medicine, and then it's allowed everyone to buy us up.
Well, and it's just ghastly, really, because you look at what Optum is doing. Optum is owned by United Healthcare. They're an insurance company. They own data warehouses. They own now they're the largest employer of physicians in the country. They employ over 100,000, and they're not slowing down. The next step will be for them to have hospitals. They already have urgent care centers and surgery centers. That makes absolutely no sense. They've completely vertically integrated. However, physicians are prohibited from owning hospitals because of the moratorium in the ACA. That's something that we're actively trying to get repealed, just that portion, so that physicians can practice their trade in a facility that they've historically had ownership in. And especially, honestly, it's the way it used to be. Hospital was owned by the doctor historically. So that competition should be available, and allowing physicians to do that should absolutely need to be the case. There was one other one, certificate of need. When I was referring to Texas, we don't even have certificate of need laws here. So that's okay. But what happens is these hospitals consolidate and consolidate and consolidate. And as they're employing more and more physicians, those physicians are not able to refer outside of that system structure. So even though we don't have CON laws, if you had an imaging center, it would be very difficult with the limited number of independent doctors that could refer to you, because the ones that are employed by the systems are not going to send you their patients, because they would suffer at the hands of their employer.
If you go back to that, the chart that David was referring to, I think for all of us, we all feel it, that the hospitals and the hospital executives are a problem. And, it's great to have someone like David, who's a former hospital executive. Then I don't think every single hospital executive is necessarily an evil. I mean, we do need some administration, but
just most of them.
I think that America views that hospitals and physicians are one, and that we're the greatest buddies here, and that we're in agreement with everything that the hospital says, and the hospital sends out their spokesperson. But it's almost as though there's a hidden war from the patients. And I think that they have to start to understand that the hospitals themselves are part of the corporate profit mongering. I mean, when you look at some of the CEOs of the nonprofits and what they're making, it's a little shocking. And I think for the public to start to understand who are really the corporations that are behind everything, and then that those corporations do not necessarily have the backing of the physicians and the nurses and the pharmacists that they trust as individuals.
Yeah, and it's not just the amount of money that they're making from their hospitals, mostly nonprofit hospitals. They're sitting on the boards of group purchasing organizations and making a handsome income, so long as they're bringing those GPOs into their facility. And let's talk about the nonprofits. I prefer to call them tax exempt. It's well, you get me started. It's hard for me to slow down on these guys, especially. It's absolutely disgusting what they're doing. If you look at, and I'm working on some research now to show their charity care. Their charity care is oftentimes less than that of a for-profit hospital that aren't much better. But the community benefit that they're offering is nominal in comparison to the tax benefit that they receive. Now, they get those nonprofit designations because they're supposed to provide at least that much and hopefully more to the community that they serve, right? That's not happening. And there was one story of a CEO when they said, well, you have a very rich hospital and you've seen them. What are you doing to give back to the community? And he says, well, we have a very beautiful lobby. I know everybody's on mute, but I could, hear the gasps or chuckles, but that was his response. That was his contribution to the community. Well, I can guarantee you that there are no homeless people sleeping on those beautiful couches. So it's disingenuous at the very least. They're not providing the benefit to the people who can't afford their outrageous rates. And honestly, and unfortunately, many of these tax-exempt hospitals are suing those very patients. Many of you may have seen what happened at the University of Virginia Medical Center. They were suing in excess of 60% of their patients and taking them to court. And our friend, Dr. McCary and his team were going to court and standing in defense of those patients. And every time they would stand in defense, they would drop the claims because they were having to disclose what their prices were, and they didn't want to do that. So there are things that we can do, whether they be small or big, but even the small ones add up. And find your areas where you're passionate or where you have a greater level of interest, and find folks that are like-minded and do something little, do something small, help teach a patient, help teach a neighbor.
One of the nice things about transparency, and whether it's for hospital, for PBM and the monies that PBM's making and so on and so forth, is that you as a physician advocate are pointing out something that's helping your patient. And when you point those things out, you're not lifting your own salary. Like I think it's like physicians, when they get involved in advocacy and some of our legacy organizations, and I'm not saying that we don't have the right to make a decent salary, we certainly do. But if we go after first the excess profits of giant corporations, we're doing our patients a service. And I really think that that will do a lot in our patients' eyes to bring back trust. And, also if you think about like the biggest third-party payers in our country, Medicare and Medicaid, when you start pointing out that some of these corporate profiteers, they're making money off of the Medicare and Medicaid system. The PBMs are robbing them at the state level. They're robbing Medicaid of money during with a practice called the spread. And you're doing a service not just for your patients in enabling their care to be less costly, in all of us as taxpayers, for us not to have to spend the money that we're spending on some of these programs, so that we open up more money so that we can take care of the future, so that medicine becomes a sustainable place. We're simply cutting out some of the glut here, some of the suggestions that we've made in Free to Care. But when we make them, make no mistake, we have people that will like flat out tell us to our face, every large corporation will come after us. I've spoken to lawmakers that, have told me they put out a PBM transparency bill and immediately their primary opponent gets funded. Mm-hmm. It's a whole coalition that will come after anyone that's willing to speak out.
Yeah, no, they absolutely will. I won't tell you the name, but I advise for 4 senators and about a dozen House representatives in Congress. And this one particular senator, he was talking about drug pricing. He said, "David, what are we going to do about drug pricing?" And I said, "You know the answer. I've already told you. I've already had a group of physicians come in here and explain it to you." And he looks up, he looks down, he hems, he haws. He says, "Well, campaigns are expensive." That's really how it works. And so one of the things that's important, and one of the benefits that we have in our coalition, is that we have a lot of patient advocacy groups as well, whether it's chronic disease patients or seniors. And you know what, and this is something that this group can absolutely do, is prior to going into that office, they will receive 10, 15 calls from their constituents, because we can locate some of the membership that is within their districts, and they'll give them a call and say, "You're going to get a request for a meeting, or you're about to have a meeting, and it's going to be on this topic, and this is very important to me." I can assure you that meeting is very different than had they not received any of those phone calls. They bring in all of their experts. The congressperson is usually there. when typically they're not. They usually have their expert there to listen to complaints, but the member will be there, their expert will be there, and sometimes their chief of staff or deputy chief of staff, and they take it very seriously because although we aren't their constituents have essentially authorized us or deputized us to stand in the gap for them because it's something they care about. And so that's important as well. Again, if you don't have money, get the people, get the voters. I had one other, there was one, Dr. Patel in the comments made a comment. No one in charge has any interest in transparency or lowering costs. You know, they're showing an interest in transparency, but I agree that they have no interest in lowering costs. They talk a big game, but they don't. All of the policies point towards increasing cost, and it really helps because the more these companies are able to generate in terms of revenue, the more they're able to give to the various campaigns or to the agencies or what have you. We're on the backs of physicians. They're creating a line of revenue that empowers them, not you and not the patient. So that is something that we need to have, that we need to change.
Another thing that I think we have to think about as physicians is our ability to innovate. You know, so Mitch, I mean, one of the great things that I think you do is your way of practicing as an ER physician in a more DPC type way, in a more direct care way. I mean, we all recognize the insurance companies are a problem. And, you know, I think that like, we can decide how we're going to answer that. Some people say the insurance companies are a problem, let the government take over. I can't, in good faith, agree to that, because if you allow the government to take over, it's going to be the insurance companies that are running the government's version of third-party paying. I think it's more important to allow the patients and the physicians to take over, so that if we picture a landscape of the future, it would be a landscape where it's more of like a public-private partnership that's really owned by the patient at its bedrock level. One of the groups that Free to Care started to work with is a group called Mitigate Partners that recognizes that the employers are taking it on the chin. And their method is like, okay, well, we're just going to bypass what we call the BUCAs, the Blue Cross, United, Cigna, Aetna, Humana. So they'll go into a community and they'll say to the community, you don't have to partner with one of these insurance companies. We'll build your plan and we'll work with the local physicians and local hospitals, and we'll set up the transparent pricing. And we'll work with a transparent PBM so that we set up your drug pricing. So, you know, David, you may remember the numbers on this, but they've worked with some school districts. They've worked with some hospital systems around the country. They've worked with some big employers, and they've saved these entities millions of dollars in a given year. I'm pushing at my own local level. I mean, we've got the third biggest school district in Pennsylvania. I think we need some of the COVID stuff to go away before they want to change things. But it would be a huge plum to get rid of CVS. And like, you can see that they've already done it in some sectors of our school district. I had a friend that was paying attention to the PBM stuff that I was writing. She was on the school board. She took the school board drug costs and went through them and started like looking and auditing, and she couldn't believe how much they were spending. So they fired CVS Caremark and they hired a small, transparent PBM, and they saved almost $1 million per year on the drug cost alone. So I'd love to see them do that with the insurance as well. But we have to start thinking innovatively, and how, like, we don't trust these big corporations. Can we find a different organization that we can trust that's willing to work and to hustle, just like the DPC doctors hustle? And we have to start thinking that not all business is bad. The people that are putting together some of these plans, yeah, are they making a living off of doing that? Sure, but they're not making a killing. And they're saving communities a lot of money in the process.
Marion, there's a great question in the chat box, and I'd like you to take the first stab. So how do you allow the patient and the physician to take over?
Well, I think physicians have to find models that they can practice in if they're willing to go out on their own and become independent. And I think we also have to recognize as physicians that not all of us are going to. I'm employed. People are very surprised when they find that out because I'm very vocal, and somehow I've managed to skirt the notice of my employer. Well, I actually don't think I have. I think they just, maybe it got too far, and if they fired me, maybe they'd be in trouble. I don't know. But I always point out that I don't speak for my large employer. But I think like as many physicians as possible have to evaluate and decide, can I become part of something independent? Can I, if there's nothing available that's independent, can I create something in my own community? So can I push back on certificate of need laws in my state? Can I push back at the national level and allow physicians owning hospitals so that we can build something together? And if you can't do that, to then join up with a larger group of physicians so you have a voice, so that you have some safety in your employment. Because I honestly have to say, I think there's going to be a large number of physicians who will remain employed for a long period of time. So getting back to that safety in numbers, I think is going to be important. And David, why don't you take a stab at the same question?
Yeah, I think you're right. It's, for, and I appreciate all the work that you do being an employed physician. And yes, would it be better if everybody was independent? Sure. But is that a realistic outcome? Probably not. But that doesn't mean that you can't be involved. So doing what you can within your current situation and supporting those that are going off and making the move, whether it be by way of encouragement or financially or whatever it might be. If it's not that, it's helping with spreading the word and letting people know that there are groups that want to make a difference, that believe in the doctor-patient relationship, that believe that healthcare is better when it's local, and not a one-size-fits-all solution.
And taking a risk. Christina Dewey, I'm going to thank you, first of all, for always lifting all of us. Like Christina's like, she calls herself shameless sharer. I think she's more like the wind beneath everyone's wings, as cheesy as that sounds. She's flapping. But she brought up HPEC. So HPEC, I always forget what the letters stand for, but it is Dr. Leah Houston's way of trying to have physicians take back their own credentials. I was an early investor. I mean, these credentials are so important. Like baseline, if we own our own credentials, that's our training. That's our training right there. And isn't it interesting? Like, during the pandemic, we talk about how the pandemic has uncovered certain things. When I came here to Pennsylvania for my training in Chicago, they told me you have to like put in all this paperwork so that you can get credentialed. It'll take you 6 months. Well, when the pandemic happened, all of a sudden I had to do telehealth in my job through Children's Hospital of Philadelphia, and I had to get a New Jersey license. It happened in 24 hours. Now, how did that happen? How was the hospital unable to finagle with the insurance companies of New Jersey and make it happen in 24 hours when before it had always been 6 months? I mean, that points out right there must be some kind of control that both the hospital and the insurance company have or share, or something that we can't see. But I think one of the things that's been hard for Leah. So Leah's put a lot of time, effort, heart, soul, and thought into HPEC. It's a brilliant idea, and it's allowing us to all own it together. But a lot of physicians don't step up to the plate. They'd rather keep the same status quo. So we're talking about all of these corporations who are owning us. We have a chance to own ourselves. And I bet many of you on here have participated, but have you tried to get someone else to participate? I think it would be a helpful thing, or to let them know about HPEC, so that HPEC can grow. And so owning our own credentials, that's going to be one of the necessary first steps in us taking back medicine and owning ourselves. That needs to happen.
Agreed. And I just saw something here in the comments. Dr. Raj Patel just sent over. It was his written proposal for how to fix healthcare, and there are a lot of great things in here. The federal and state level, and at the state level, one of the things that I'm looking to push in the state of Texas, as well as a number of other states, once we can do it here, is eliminating these non-competes, because one of the difficulties in going independent is, well, I've got to leave the state or find a new place to live if I leave my employer, because these systems are so massive that if you go anywhere that they don't exist, then you're gonna have to go several hundred miles. So if we believe that there's a physician shortage and we want to have physicians in our community, then we've got to get rid of these terrible non-compete agreements. I think
Raj, thank you for your direct shifts post. I'm going to copy that and try to take a look at that later. It looks great.
Yeah, some good stuff in there. And I think, Mitch, I think we've come up to time. I want to be sensitive to the schedule.
Yeah, we're right about there. Thank you guys so much for this discussion. You know, and we will be having this evening a panel on, you know, what the American College of Emergency Physicians really needs to do to stand up to corporate medicine. But tomorrow, we're also having David back on a panel of concrete steps to take medicine back. And I think that's where I'm hoping all of the panelists, all of these speakers here can even learn something from one another. And maybe we can distill this into actionable items. And I know David Free to Care has several of those on the docket. Something I want to keep in mind for, you know, moving forward is we have to sort of, I love the idea of direct care, but at the same time we have to recognize the fiscal inequities. And if private equity is the greatest wealth concentrator that this world has ever seen, which it's been described as, we have to see that it's, you know, it's creating great poverty. And I think that's one of the biggest challenges here is, you know, how do you redistribute some wealth and finances to people while being fair and transparent, and recognizing that even direct care, of course, you're going to need some sort of risk distribution, really insurance that works to complement it. So something just to keep in mind. If you want to speak to that for 1 minute, we'll be right at our wrap up.
I'll be addressing that tomorrow, actually, and I don't know that I can do it justice in 1 minute, but we did try to do that here in Texas, and it was heavily attacked by the insurance companies. I'll share that story tomorrow, so I'll leave a cliffhanger.
Perfect.
Always a good thing.
That keeps us going. And all right, thank you both for joining us. We will actually just jump right to a little wrap up of this morning. And yes, feel free to check out freetocare.org, FREE2care.org, and take a look at what Free to Care stands for. And I really do find this encouraging because I think even if there are slight ideological differences, I saw a Medicare for All discussion in there. I think, to be honest, we all really want ultimately the same thing, but we're sometimes presented with a false dichotomy from politicians. You know, is it Medicare for All, which might be co-opted by United Health, or do we stick with private insurance, which we know is broken? Keep your insurance company. We don't want to keep our insurance company, but we all want access to high quality medical care without being bankrupted. Pretty simple, I think, in terms of what we actually want.